Hi, welcome. This is the fourth Coffee with Cassie, and I am excited to welcome you here to our Everett station. This is a regional transportation hub and a career development center. It's home to Bezos Academy and Citron Health, and there's going to be a new railway museum here shortly. The last Coffee with Cassie, I met with business leader Brian Olson, and we started talking about the impacts of the fentanyl crisis and how that was impacting local families and businesses like Brian's. And it was a great conversation. And during that time, I talked about launching my mayor's drug crisis task force. And now I'm excited to have a discussion with the co-chairs of that task force because they've just completed work over the last few months. And we're going to learn about what they did and the recommendations they're bringing forward. And now let's go get some coffee from Dietrich Espresso, and then we're going to go upstairs and meet with our co-chairs. Well, welcome to both of you. We're here in the warehouse room of Everett Station, and I just want to thank you both for your work on the task force. We're joined by Donna Moulton, CEO, Executive Director of Housing HopeWorks, and we're also joined by Jonathan Swartz, who's the Senior Vice President of Corporate Development of Fortive. Thank you both, and I know you both have enormous jobs, and you gave willingly of your time and energy to be a part of this task force, and I just really appreciate your leadership.
Thanks for having us.
We're glad to be a part of it.
The drug crisis that we're all experiencing impacts everybody. And so having folks that are, kind of the boots on the ground, they're doing the work, as well as businesses and communities that are being impacted by what we're having in our community was really important. And I think I had that experience as an executive as well. So
I know for myself, I was really glad to be able to participate in this as much as I feel like this is something that I deal with day to day in my job. It really helped me to get a better understanding of how the community is experiencing this crisis and some of the struggles that are universal for folks in trying to deal with this. But I'm really curious about what really got you into thinking about creating the task force for us to come together and do some really big thinking and consideration of the drug crisis going forward.
There isn't an aspect of city government that isn't impacted by the drug crisis. And when you think about the vast majority of crimes that we're seeing in our city, you can trace so many of them back to this fentanyl crisis, whether it's nuisance and property crimes or burglary or even leading up to gun violence and gang activity that we're seeing. A lot of it can be traced back to the drug crisis. And then my background as a nonprofit executive, helping people who are struggling with addiction or helping people with homelessness, we really want to make the city a safer, better place for everybody. And so I was moved to try to help those that are struggling. I also, like so many of us in our community, have a family member that is dealing with addiction. And I think as a local government, we can't solve all these problems, but the community really expects and needs our leadership on these really sometimes what seem to be unsolvable dilemmas, and wanted to bring together the best and the brightest minds across all sectors, if possible, to get together and talk about it, learn about it, and maybe help make some recommendations that we might not come up with on our own as a city government.
Working in affordable housing, we see day to day the impacts of the drug crisis on our tenants and on families that are living with us. And not that it is unique to affordable housing, that's something that's experienced across all sectors of housing, but we do see it daily impacting families in a way that really undermines their ability to maintain stable, safe housing going forward. And so for me, it was important to be a part of this group so that I could hear what other experiences folks in the community are having, and for us to strategize some ways that might be impactful for creating some positive change around this issue going forward.
So for me, it was a great opportunity to represent the business community. You introduced me as part of the leadership team at Fortive. We've got about 18,000 folks on the team worldwide, headquartered here in Everett, and more than 1,000 people working in Everett, and another 1,000 in the Portland area. So really, our communities are super important to us from the standpoint of these are the places we work and live every day, and what's going on there is incredibly important to us. And as you know, we volunteer where we can, and this was just a great opportunity to be a part of the dialogue, try to bring people together, for a common cause.
I so appreciate that. In fact, I think that's one of the things that makes our community so special is the willingness of everybody to get together and try to solve our community challenges and better our community. For those that didn't participate, can you share a little bit about, how the task force was structured and the work that when it was underway?
Sure. So we had several meetings. I think 9 meetings over 4 months. We received some really great educational information about just sort of the basics of addiction, specifically around fentanyl and some of the other substances that we're using. We got to hear the experience of other service providers and business owners throughout the community and what their experience was. And so we sort of had some informational pieces that informed 4 groups that then worked to provide some recommendations. So to listen deeply about what the issues were, to try to take that information and create some recommendations that we could provide to the city around several recommendations that we really feel could be impactful for Everett moving forward to address the issue and hopefully create some meaningful supports for folks that are impacted by the drug crisis.
I'd just emphasize something you mentioned there was, Mayor, you brought together a really diverse team, 40 people from all walks of life in the community. We had folks with lived experience. We had people like Donna on the service provider side and the nonprofit side. We had first responders from the city and folks who had really a lot of different perspectives on the problem. And so I thought, wow, that can be challenging for the team. It really worked incredibly well across the 9 meetings. Everyone got a chance to talk about their own perspective. And so from the standpoint of really getting a full view, and for me, learning, you mentioned too, Donna, it was incredibly valuable to hear all of that and have that be an input to the recommendations that we ultimately got to.
Yeah, I think having that diversity of minds at the table is what really, can put together a solid plan. So yeah, thank you. What part of the work do you think was most meaningful when you kind of reflect back?
I would say that the sort of the universality of the experience of how this is impacting our entire community, for me, was really meaningful. I think that one of the meetings that we had the opportunity to participate in was something that we called the fishbowl activity, where we got to hear the experiences of our first responders. And I think that it really helped to see the breadth of the crisis going forward in social services. I certainly feel like we're living that day after day after day, and that there are varying degrees of it, but that we're always experiencing that. And to hear the deep impact that had on folks who have to respond to those crises without necessarily knowing the breadth of what they're getting into whenever they respond to those pieces, and the day-to-day impact that has in trying to be in that space and create a safe space for community members was really impactful for me. It gave me a very different perspective of how this influences the entire community and not just pockets of it.
I would say something similar. For me personally, it was the first time, as a business person who comes into the city to work, it was the first time I ever had the opportunity to pause and listen to folks with different perspectives and different experiences. And so the education side of it, the learning side of it was just incredibly valuable to me personally, opened my eyes to things that I didn't know. And then on the other thing that I think was important to me was it was inspiring. It actually was inspiring. Every group that was represented, you could tell cared deeply about what they were trying to do on a daily basis, but also that they valued the opportunity to share and collaborate. And so seeing that group dynamic, I think, was a reminder to me that everyone was in it together. And that was super powerful and I think critical to getting to the recommendations.
The fact that we had the opportunity to have folks with lived experience in our midst was very, very moving, and it really lent another lens to the conversations that we were having, that we were really able to see sort of from the very beginnings of what experience were through like interpretations, and really challenged some of the assumptions that we had around the drug crisis. And so it was really great to ground in what folks' actual experience was, the things that they found that were helpful, things that never would have helped them in a million years. And so to sort of put our recommendations in perspective within that continuum, I think was really helpful as well to focus those recommendations moving forward.
So Mary, you were just talking about the complexity of the problem, and that really hits with me because I remember as we got ready to kick off the process of the task force, I had a million questions for you, and you were super patient trying to frame it. But then in the first few meetings, I think the complexity of the problem really hit hard. And I think everyone to your point, really had their eyes open to it. So as we got into trying to work toward some tangible recommendations, as a product of the task force, we realized we had to break it into some workable pieces, and so we formed many collaborative groups within the task force. We got it into 4 subgroups, and those were education and prevention, and then crisis response, treatment, recovery, and services, and finally advocacy and policy. So with those 4 working groups, we tried to cover the problem in a simple, digestible way through the process.
That's smart. Best way to deal with something this challenging is to break it down into different pieces.
Yes.
Yeah, so I'd love to dig into the recommendations and just hear a little bit about the recommendations that the task force came up with.
Treatment, recovery, and services. We talked a little bit about the treatment resources that are available in Snohomish County, specifically in Everett. While we know that we have a lot of dedicated providers and are very skilled in providing that work, that we just don't have a sufficient number of resources available for folks moving forward. We had the opportunity to listen to the city's social workers when they attended a meeting and had us move through a scenario so that we were really in the moment of what it is that they have to deal with, which gave us a better understanding of what kinds of responses, given the issues and challenges that an individual might have, might be really important or more meaningful as we move through the work to provide those recommendations. So it really helped us to understand what a day in the life is for folks that are trying to help folks that are impacted significantly by the drug crisis. As a result of some of those discussions and some of those experiences that we had as part of the group, we realized that it was really important for us to have a strengthened comprehensive care response to folks that have issues with addiction and are often on our streets struggling with that. So as a piece of that, we were also looking at the EMOTE model and really being able to deliver necessary services wherever folks are. We talked a little bit about some of the challenges that folks who are experiencing homelessness might have with accessing resources and being able to actively engage in that. So again, removing as many of those barriers as possible so that
bringing
folks,
that mobile unit to people.
Absolutely, so they can make a decision that they will be able to move forward with treatment. Realizing that folks have difficulty getting to appointments and with getting their stuff stored someplace. And so really trying to look at all of those potential challenges that make it virtually impossible for somebody to engage effectively in treatment. So those are some of the things that we were looking at. We realized that the sheltering options that we have throughout Everett and the county are just insufficient for the level of needs that somebody has who's in active addiction. And so really focusing on that. How do we flush out that continuum that provides those services for folks who have that specificity of issues going forward? So we talked a little bit about that and the importance of that, and the ability for us to communicate better about the resources that are out there. So not having any kind of reliability of how we can access those, which we know are really important for folks whenever they are contemplating treatment, and being able to actually successfully move on that path towards recovery. So just really looking at strengthening the resources that are available for folks to access those much needed treatment services going forward so that they can move into active recovery rather than active addiction.
Yeah, we want as many resources as possible, right? But having a roadmap of how to access all those different resources, it's important.
It's complicated, and the eligibility pieces that are a part of that. So just looking to streamline that so that you don't have to have a degree to figure out how to navigate that system, that the folks that really need to use it can figure that out too.
Yeah, and that will certainly require the city to work with a lot of our partners, right?
Yeah.
So many of these resources are not city funded. That's outside, it's either nonprofits or maybe they're county programs, and just having us work with those different systems and try to create that plan makes a lot of sense.
Yeah, sure does.
So another working group that we had was called Crisis Response, and this was had participants not only with lived experience but also first responders. Who are super active in the dialogue. I spent a lot of time with them. It was really interesting, and the themes that came through that. We had this meeting that Donna referenced called the Fishbowl, where the first responders were in the middle, being vulnerable and sharing their stories, and that was incredibly powerful. It wasn't the only powerful meeting we had, but in particular, as related to crisis response, it was really memorable. And that fed, I think, a lot of the dialogue and the ability for folks to connect across their own experiences. There were a few themes here. I think One was the desire to have the resources deployable, but first responders in the city operate within a set of rules that you don't have control over, right? And so there are real difficulties and limitations on what they can do, whether it's the law above and beyond Everett, et cetera. So working within that framework and trying to redirect resources to be more effectively deployed, because one of the things I learned through the discussion was just how much the crisis is accelerating, but the resources aren't accelerating. And so there's a real strain on these first responders. They're trying to be effective on a case-by-case basis for everyone, but the demands on them are just spiking. And so trying to get around that, and then also at the same time find a way to support the first responders, who are, after all, human beings, as they encounter this on a daily basis and really bring everything they've got to the equation. So those things came through, and I thought that the recommendations ended up being really pretty practical in the context of those limitations.
Yeah, I remember that conversation when watching and listening to the first responders have a dialogue, and it was heartbreaking in a lot of ways, right? You think of those on our streets that are struggling with addiction and how hard that must be for them and their families, and then you think about the people who are responding to those that are in crisis, and again and again and again over the course of days, weeks, months, and how hard that is to carry that load. So yeah, I think that was a really impactful meeting as well. I look forward to hearing the recommendations.
Sure. So in terms of recommendations from crisis response, there were really four key recommendations, and I'll go through those here quickly. So first, there was a desire to identify and reimagine the existing physical spaces that the community has that could be used to help fight the crisis here. So when you have limited resources, redeploying those in a smart way is something that we can control, and is available. So the crisis response team wanted to try to do that. Buildings, community spaces, to increase capacity to deal with the crisis. The next recommendation that the group came to was a general desire to find more funding, more capacity, and more training support for the folks who are in the public and emergency services here. I think that's really an expression of their earnestness and wanting to always do more and better with what they can. But that obviously, again, has a resource element to it. The third recommendation was, you have a lot of different agencies and groups in this category trying to work together. And sometimes the sharing of information can be a barrier or slows them down or makes them less effective in the moment in terms of delivering the best possible solution for the situation that they're facing on that day. And so there is a view that, and a recommendation here, that finding a way to improve the information sharing, and that could be a technology investment or other way to create a single source of truth for the information side of what they do. And then last recommendation from the team was to try to increase the overall tool set that the individual first responder groups have to bring to bear, right? So that they give more tailored and effective solutions to the crisis that they encounter on the street, and not be casting about or feeling limited by that set of existing tools, but really to think about new tools and also streamlining and making more accessible the tools they have to be able to be deployed at a moment.
Yeah, that makes sense. Each person is unique, individual, right there.
There's no one situation they encounter. It's probably several different in a day.
Yeah, absolutely. So I think there were also recommendations in education and prevention. Is that another?
Yep, that's next. I'll cover that one too.
Great.
So as we mentioned, another one of the working groups was education and prevention. And to me, I think of this one as having two big themes. One was, and obviously the whole nature of education and prevention is trying to get to the front end of the problem. Yeah. To reduce the problem, right? If we can reduce the problem, we're going to have a flow through of benefit to the overall effort. But the two themes, one was the importance of focusing on the youth here. Definitely. Lots of studies that show that 12 to 25 is really the critical or biggest represented group in terms of dealing with this crisis. And so we had representatives that accounted for that on the task force, which was great. I thought they did an awesome job and really dove into it. And the other theme that was important was also the accessibility. I mean, Everett's a very diverse community, and so just having help in English or only available online or that type of thing just doesn't really cut it for the folks who actually are encountering the crisis. And so those two themes, I think, really flow through the education and prevention recommendations.
Yeah, absolutely. And that resonates with me. Obviously, my background was working at Cocoon House, helping young people. And I think the earlier we can get resources out and help people understand how dangerous these drugs are, the better, the more impact we can have. And certainly reaching our beautiful, diverse community and helping them access resources or hopefully keeping them safe in the first place.
Great. I'll go through the recommendations from education and prevention as well. They were super efficient, this working group. They got down to really two very fundamental recommendations. The first was to expand and diversify the partnerships with youth-serving organizations. So this may seem obvious, but I think it's really important in terms of multiplying the impact in terms of reaching that group, with the goal being obviously to prevent the drug use through education and culturally appropriate engagement on an ongoing basis to youth and the families, the parents. Mm-hmm. The other recommendation from the education and prevention working group was to launch culturally responsive outreach activities and awareness campaigns. And I know that during the task force, they actually started going out and doing, right? They took some of the education materials. Why wait? They were actually out going to events in multiple languages, et cetera, to spread the word on the education front. So, that understanding of risks, I know I feel personally so much more educated through the task force. Spreading that through the community, I think, helps folks appreciate the struggle that everyone's going through and to be there for each other. So they were all over that as a recommendation.
So I think we have one last bucket of recommendations,
we do,
right?
The advocacy and policy piece. And so when this group got together, it became clear pretty quickly that there are a lot of factors outside of what actually gets decided at the city level that impact the way that we're able to respond to the crisis in general. So that kind of kept coming up over and over with laws at more of the state, regional, federal level that really impact our ability to make changes at the city level, and realizing that we really needed to be able to advocate for that in the greater community, as well as advocate for some funding to come in to address the issue as well. So that in general was sort of how we couched that discussion. With our recommendations being some advocacy to amend Ricky's law to make it less restrictive so that we're able to actually get in there and provide supports whenever somebody might not be able to decide on that for themselves.
Sure.
Going forward.
Can you explain what Ricky's law is?
Sure. So Ricky's law brings into impact the option for folks to be committed involuntarily going forward, so that they can get that treatment, especially when they're of danger to themselves or others.
It can be a difficult thing to talk about, why involuntary treatment is so important, but it really is because so many of the folks that are deep in this crisis aren't aware or aren't able to get the help they need. They aren't aware that they need that help, and they're really slowly killing themselves on our streets, and it's negatively impacting our entire community and their families and our first responders, as you shared. So having that tool be able to get more people the help that they desperately need, save lives, until they're at a space where they can actually then actively engage and accept treatment. That's been a goal for a long time. There's been this gap in our community where folks are engaged in criminal activity, causing a lot of harm to themselves and others. We'll arrest them for the criminal behavior. We'll try to, bring them to jail, but of course they're sick, and jail is probably not the best place. And then jail says, well, that criminal justice system says they're not able to assist in their own defense. This isn't the right place for them, and so they should be released. I believe they should be released into treatment or medical care. And it sounds like that's one of the recommendations that this task force came up with as well. So I really appreciate that, and that will be helpful for me as I advocate with other mayors for just a little changes in this law that already exists that will help us help more people and get them the treatment they need.
Advocating for long-term state and federal funding to support the work that we're doing at the local level. So the work that we're doing here in Everett is very different than any other city in the county. While there are lots of things that we can learn and things that we can do similarly, each community is different. So really making sure that we have that funding that allows us to make the decisions that we need to, that are best for Everett going forward. Support for a multi-jurisdictional drug task force. So one of the things that we learned was that some of the funding for those kinds of task force has been shrinking, as Jonathan was sharing earlier. And so, we were recognizing in the great work that we were doing, and also realizing that there's so much to be done, that if those resources are shrinking, then we're going the opposite way. So really advocating for that funding to be able to support what cities are doing, that hopefully we can weave that together into a more regional response moving forward. And then finally, looking at sort of the victim impact and creating some resources to help support folks that are impacted on the victim level from some of the behaviors that we see, either from other individuals who are addicted, or some of the criminal behavior that's sometimes associated with that. So really sort of looking at restorative justice and how we're able to impact the greater community who's been impacted by addiction issues, while maybe not using substances themselves, but being able to really have a community-focused response to that going forward.
That's great. So I definitely, I think we have our work cut out for us as a city to a good advocacy agenda. I think that was certainly one of the goals, to hear from this task force what we should be asking for. And so that's going to be a very helpful tool for the city council and me, and to advocate for those resources and systems that we need improvement in to do better work here. So I appreciate that. Council and I will now get to work on digging through those recommendations. Our staff are already in that work at the city, and we'll do what we can as a city, and we'll start to reach out to partners and focus on our advocacy agenda. But I'd love to hear, any final thoughts on the task force from each of you, and next steps for each of you moving forward.
I would say that first of all, I didn't really know what to expect whenever I showed up and started doing some of this work. And I think that, it was such a multifaceted approach and such a thorough conversation that we had. Quite honestly, it was, at the very beginning when we started the meeting, we had to pick little pictures about, or maybe it was after the first meeting, we had to pick little pictures about how we were feeling. And to tell you the truth, we had to do that again at the very end of our time together and meeting, and thinking a little bit about the pictures that were chosen. Like from the beginning, there were like a lot of kind of frowny faces, or maybe like skeptical faces, but I will say for my table, and I think it resonated through all the tables as we were doing our final meeting, there was such a sense of optimism about that this is something that we can work together and create some solutions around, and hopefully ultimately positively impact the lives of folks that aren't doing so great right now. And so just having that sense of optimism through days that have felt anything but optimistic, as we've seen the impacts of the addiction going forward, and then feeling like there's just a sense of just a really strong team that's invested and has such deep caring about this issue, how it's impacting our community, how it's impacting the people that are experiencing that, whether directly or indirectly. It just gave me such a sense of optimism of, every day is not going to be great as we're going down this road and trying to implement certainly some of these recommendations and activities that we know can be helpful. But there's a great team that's doing this together, a lot of really smart people that are doing some really great things that we can expand upon, and lots of people who are open to looking at things in a different way to try to find a solution so that we can mitigate the impacts of this crisis going forward.
Yeah.
Really well said. Well said.
Thank you, sir.
I would just maybe follow on with that with a couple thoughts. One is, as we said in the beginning, this crisis is just incredibly complex. Incredibly complex. It's one of the biggest, most complex problems that I have ever looked at or been involved with, even at a surface level.
Yeah.
It's a human thing. It's a human crisis. And I think at the end of the day, the solutions all involve people doing what I think you used the words early on, rolling up sleeves, right? Mm-hmm. And for me, I think of that at a few different levels. First, in terms of the city and the team that you have, I've already said this to you, but you have an incredible team. One of the best teams tackling a hard problem that I've seen, and I've seen quite a few. So thank you to them every day for their efforts, and the community and the city of Everett can be proud, and you can be proud of that team and the work they're doing. Secondly, for those who aren't spending 24/7 doing what Donna and others in the city are doing in terms of working all day, every day to combat the crisis, business leaders or others, I think what we can think about doing is bringing what we can to the problem. And to me, again, that's people. It's our time, it's our ideas, it's volunteering, just little things, because they're not going to be quick solutions here, most likely. We'll find them if they're there, for sure. But there probably won't be a massive silver bullet to this. And so I think chipping away at that and giving what we all can serves the greater community. And we're all part of it, whether that's business or the city and first responders or folks experiencing the crisis. And so remembering that human, we're all in it together part, I think is just something that sits with me. And another part of the process, we wrote down our personal commitments at the end. And for me, it was, my personal commitment is that I'm going to continue to talk about this, and it's not just going to be like a project that got put on the shelf in a nice binder. And some of those conversations may resonate with someone and others may not, but I'll keep talking about it and keep trying to learn about it to see what we can do. And then when my colleagues and I have our volunteer opportunities, they mean a little more. They mean a little more to be really involved in trying to be part of the solution.
What you said resonated a lot, that kind of at the beginning where people are skeptical and it's like, this feels like an unsolvable problem so often, especially to so many of our team members that are doing this day in and day out. And so to get to this point where you've done all this work and you presented these recommendations and we have people that are motivated and they understand the issue that we're dealing with in our community, and I am filled with hope. And it's not something I expected to have at as the end of this work. But I think your work has really inspired a lot of people. And I'm proud of the work that you've done. I'm proud of our team. Thank you. I will share your praise with them. But I really am proud of this community because it is our community and our ability to work together and come up with new solutions to these really challenging problems is what makes us a stronger team, stronger community for it. And so I look forward to the work, and I really do think that we are going to make an impact, and we are going to positively affect a lot of lives, and we're going to be a leader in solving this challenge that is not unique to Everett. That's all across our country right now. So again, thank you both so much. Really appreciate it.
Very well.
And please, as you continue to learn and read and have conversations about it, continue to share those new ideas with our team as we will continue this work as well. Thank you for tuning in to Coffee with Cassie. Again, thank you to my task force co-chairs for joining me today, but really appreciated the conversation. I'm very optimistic about the work that we're going to be doing to tackle our drug crisis and hopefully help a lot of people in need. And I look forward to coming back and having a future Coffee with Cassie with other community leaders and staff to talk about issues that our residents' businesses care about. So I look forward to seeing you again soon.